Careblazers, medication can be a lifeline for managing your loved one's health. But what happens if they don't want to take it? This is a frustrating challenge many caregivers face. Today, I'm sharing what not to do in this situation, along with some tips to help make medication time a bit more smooth. Let's dive in. So why do people with dementia sometimes refuse to take medication? Before we talk about what not to do, let's talk about why this happens in the first place. Not wanting to take medication is often rooted in things like confusion. Your loved one might not understand or remember why they need the medication. Number 2, fear or disgust. Changes in cognition can lead to suspicion of pills and liquids. Number 3, sensory issues. The medication might taste bitter or awful, or your loved one might be having trouble swallowing. And number 4, independence. Saying no might be their way of having some control in a world that feels like it's increasingly outside of their control. So here's what not to do if your loved one is not wanting to take their medication. Number 1, this can be hard. Don't force it. Trying to force them taking medication can make it less likely that they will take medication in the future because it escalates their fear and anxiety and increases their resistance towards you, especially around medication time. Number 2, cardinal rule of dementia caregiving: don't argue. Trying to convince them of all the reasons they're supposed to take their medication can lead to more frustration for both of you. Remember, in dementia, the brain doesn't process information in the same way, so our attempts to reason with them often don't work. Number 3, possibly don't sneak it. We'll talk about some exceptions to that in just a moment. But if your loved one is, especially in the earlier stages, or still with it enough, and you sneak it and they find out, that can really break trust. So we've talked about what not to do. Let's talk about what you can do. Number 1, simplify the explanation. So perhaps instead of saying this medication is for your blood pressure, you can say this will make you feel better. That kind of approach might work. Number 2, change the form of the medication. So this would involve talking to your loved one's healthcare provider and asking if the same medication might be available in a patch, a chewable, a liquid, some other alternative than the pill version that they're having trouble taking. Number 3, make it routine. Make it as normal as possible by pairing it with an everyday activity that's just a normal activity. Like perhaps you pair it with eating breakfast together or before you brush your teeth. And bonus points, you could do it with them and take your medications or vitamins alongside of them to normalize it even further. Number 4, you can use positive reinforcement. Basically, this just means after they do take their medication, whatever that might be, we reward them with some sort of pleasant treat or activity or something they would enjoy so that they are associating the medication taking with something good. Number 5, this is especially if you think they are having a negative reaction to the taste of the medication, is to disguise the taste. Obviously, talk to their prescribing doctor or pharmacist, but you might be able to disguise the taste by putting it in food like applesauce or pudding or another favorite food. Again, check with their doctor. Number 6, this approach can work with all kinds of different dementia-related symptoms, would be to stay calm and try again later. Take a step back if they're feeling upset, try again later. A lot of times trying to push in that moment will make them more resistant. Now let's talk about maybe some proactive ways to prevent them from not wanting to take their medication in the first place. So maybe you're not facing this challenge right now, and you don't want to face it in the future. These are some things that can help you. Number 1, involve them in decisions. So let's say it's medication time, and instead of just saying, take your medication or here's your medication, you can ask them, hey, do you want juice or water with this medication today? Or do you want juice or water with your vitamins today? Whatever you want to call them. Number 2, minimize pill burden. This is a big one. I've worked with patients who were on over 16 different medications. Do you know, I have a hard time keeping up with my daily vitamins. Imagine taking a ton of medications a day. That is burdensome. So talk and work with their doctor and pharmacist about how can we consolidate medications as much as possible. Reduce how many they actually need during the day. There's also lots of things that can be done to change the scheduling of medications. Number 3, create a calm environment. So whenever it's medication taking time, it's calm, it's peaceful, it's not chaotic. Number 4, this can help breed compassion in ourselves, is to educate ourselves. Educate ourselves on some of the side effects that come from some of these medications, like dizziness, nausea, and address those with the healthcare provider, because that might certainly also be a reason they don't want to take medicine. So let's talk about some of the key takeaways. Number 1, not wanting to take medication is a common challenge for many dementia caregivers. But with some key strategies, we can make it more successful. Number 2, avoid arguing, forcing, and if possible, sneaking the medication. Number 3, focus on simplifying and creating calm routines to help promote compliance. And number 4, always involve the healthcare providers who are prescribing the medications and letting them know how your loved one is doing with taking the medication, because there might be other forms of the medication possible. They might help you come up with more creative ways that are safe to give them that medication, whether it's putting it in food. They might even be able to adjust how many times a day the person has to take it by consolidating medications, etc. Careblazer, these are the kinds of challenges we talk about every single week inside of our Care Collective. And because we have an amazing group of Careblazers who come together, who many of us have been together through the years, we share the strategies that have worked. We share the strategies that have absolutely backfired. One of the greatest things is that we get to learn from each other. If you're interested in joining us in the Care Collective, there's a link below this video in the description that you can click. I've also included a link for you to download our free Dementia Careblazer Survival Guide if you haven't already. It's filled with practical, real-life creative solutions you can start applying right now to help manage and get through some of the most challenging situations with as much peace as possible for both you and your loved one. I'll be back next week with another video. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.